Okay, before we were to enter the patient's room, we would go ahead and check their chart. Once we walk in, we would shut the door for patient privacy, go ahead and perform hand hygiene. We would go ahead and use 2 identifiers to make sure that we have the right patient. So I can go ahead and introduce myself. Hi, I'm Miguel. I'm going to be a nurse today. Do you mind telling me your name and date of birth?
My name is Hannah Ward. I was born on July 21st, 2000.
Awesome. Do you mind showing me your wristband real quick? Awesome. So now that we've used 2 identifiers, we now know that we have the right patient, so I can go ahead and ask them some subjective questions. How are you feeling today? Do you feel any pain?
No.
Okay. No soreness in your muscles, anything like that?
No.
No pain in your arms, legs?
No.
Okay. Have you ever had, just go ahead and jump into serious stuff. Have you ever had brain surgery?
No.
No? Okay. Do you have a history of falling?
No.
Okay. Now, do you walk? Do you use any device like a walker, a cane, anything like that?
No.
Okay. What about headaches? Do you get headaches frequently?
No.
No. Okay. Vertigo?
No.
No. Okay. All right. Very decent. So, after talking to the patient for a little bit, I can see her posture. She has good posture. Her speech is clear, coherent. I can understand her very well. She's dressed appropriately for the season. She's well groomed. Her affect is appropriate for the situation. So now I can go ahead and check her alertness and her alertness and her coherence. Yes. No, alert and consciousness. Okay. Tell me your name one more time.
Hannah Ward.
Okay. What year is it?
2021.
Okay. Where are we?
In Chicago.
Okay. Perfect. So the patient is alert and oriented. That's what it is. It's not consciousness. It's oriented. So she's alert and oriented times 3. So now we can go ahead and begin the portion of the musculoskeletal assessment. I'm just going to start off just by, feeling your arms and your legs. I'm going to be feeling for any swelling, any edema, anything that should be taken note of. All right, so I'm just going to go ahead and feel. Okay. All right. Go ahead and feel your legs. Okay. All right. Now I don't feel any edema in her upper or lower extremities. Now I can go ahead and perform some strength tests. What I'm looking for is, I'm going to be rating her on a scale from 1 to 5. But she's young, so hopefully she's going to be 5 out of 5 on upper and lower extremities. So we're going to be doing a pull test, so go ahead and pull on my fingers. Good. All right, so I'm going to pull, and you're going to pull. So go ahead and pull against my resistance, okay? Good. All right, now I'm going to have you push against my hands. Good. All right. So her strength in her upper extremities there are 5 out of 5. Good strength. I'm going to have you go ahead and shrug your shoulders. Now I'm going to have you push against my hand. Good. Good. All right. Do you mind looking side to side and then up and down for me? Okay. Patient has shown me full range of motion on her, of her neck, and she was able to shrug, which would indicate cranial nerve 11 is intact. Now we're just going to go ahead and check your range of motion of your arms. So can you do this? Okay, very cool. Can you do this? All right. Go ahead and do a windmill for me real quick, like with your shoulder. Okay, awesome. Now with the other one. And reach for the ceiling like as high as you can for me. Okay, all right. And can you just, like you're doing bicep curls? Awesome. All right, so patient has shown full range of motion of her upper extremities. And now we can go ahead and move down to her lower extremities. All right, give me 1 sec. Okay, so go ahead and lay down. All right. Now lift your legs as high as you can.
Both of them?
One at a time, fine. Good. Alright, now the other one. Okay. Awesome, thank you. Alright, now with your feet, go ahead and do this for me. Yeah. Alright, perfect. Full range of motion on her lower extremities as well. I don't know if you can see it. Oh yeah, it's fine. I'm gonna have you go ahead and do it against my resistance though, okay? So with your knee, go ahead and bend this, alright? So bring it up. So push against my hand, good. Now with your foot, push against my hand, good. Now we're gonna go ahead and check on the other one. So with your knee against my hand, good. Good. Alright, perfect. Her strength in her lower extremities, 5 out of 5. Same with her upper extremities, very strong. You can go ahead and sit up. So now what we're gonna be doing is we're gonna be checking her balance, her gait, and her Babinski. We can do her Babinski real quick actually. So I'm gonna have you go ahead and lay down again for me. I'm sorry. Okay. So for Babinski, what we're looking for is we're looking for her toes to react, but not outwards. We don't want her toes to spread out. That would be found in infants. So we're gonna go ahead and check that by running the spoon up her foot. Sweet. Okay. All right. All right. Tickle.
Mhm.
Okay. Okay. All right. Go ahead and check the other one. Okay. So there was some reactiveness in her feet. But her toes didn't spread out, and there wasn't any serious curling outwards.
Can I sit up?
Yeah, you can go ahead and sit up. No serious curling outwards, indicating a negative Babinski test. And also, while palpating her upper and lower extremities and feeling her face, the skin is warm, dry to the touch. The tone is appropriate for ethnicity, pink undertones. I don't see any bruising, no swelling, and I didn't feel any edema. So now what we're going to be doing is go ahead and stand on. If we set this up, maybe I can, perfect. Okay, so go ahead and just stand normal, both feet side to side. Yeah. All right, go ahead and shut your eyes. Okay. All right, good. So that was the Romberg test. What we're looking for there is people that have a normal sway to them. That's just natural. But if there were any serious swaying or she was falling over, that would indicate a problem with her balance and her ear, and further procedures would be taken place. And now I can just go ahead and check her gait. So I'm gonna have you go ahead and walk down there and just back. Okay. All right, so patient she has a steady gait. She wasn't stumbling, she wasn't falling over. No use of a cane, walker, perfect balance. And just to recap, so 5 out of 5, upper and lower extremities, no history of falls, no use of any assistive devices, no fall risk, warm upper and lower extremities, warm and dry to the touch, appropriate for ethnicity, her skin is, negative Babinski test, and full range of motion. So that would conclude our neuromusculoskeletal assessment.